Hi, I'm PT Dan, the Kids Cancer PT. Hey, are you a PT student or a newly licensed PT, but maybe you're undecided about where you want to practice? Why not invest in improving the lives of kids with cancer? It's a great way to spend your day. But why take my word for it? Today I'm talking with the mighty Lynn Tanner. Lynn is a highly published researcher, program developer, and author of the industry standard assessment tools for kids with cancer. But most importantly, at one point, she was right where you are. So take a look at this. Hey guys, it's Lynn Tanner. You knew me as a student, and now I'm beyond that point, but you also helped me get beyond that point. So what I'd like to do is talk to students, making a video for students, so that they understand like some things that they can do if they are interested in seeing kids with cancer. So if you want to work with kids with cancer, what does that look like? And how do you go about finding the knowledge base that you need to get into that kind of a practice? You were there once, you know. You were right where they were. I've been right where they were. And we have sort of self-taught, although I have bugged you an awful lot. What's your go-to advice for somebody who is maybe finishing up PT school or is just starting PT school, but knows that they want to work with this population? What's maybe one or two things that you can say that, okay, this is what you should do, or this will get you started? What's a good starting point?
I think they need to try to either get a clinical or work at a large children's hospital. Because even if they can't get into pediatric oncology right away, I mean, if you really want to do this, that's where our patients are.
A lot of volume.
Lots of volume. You know, it would be hard, let's say, like if you went into schools to get much exposure.
Yeah, you're not getting maybe one or two over a few years or something.
So if you would get into a hospital program, hopefully you would get some exposure there. I think the other thing is to start reaching out to people who like you.
Build a network?
Myself, to build a network.
Build a network.
For sure. We love students, you know, and hey, I do research and there's always work to do.
She's probably got a volunteer research position. It's like ready-made for a student.
We
do.
Oh
my goodness. Do you hear
joke.
this?
So move to Minneapolis.
Move to Minneapolis. That's the only, that's the inclusion and the exclusion criteria.
And I think the other thing is persistence. Persistence. You know, never be afraid to call somebody. Never be intimidated.
You cold called a researcher.
I did, totally. I walked into a physician office and started talking to oncologists. You know, and what's the worst thing that can happen?
Firing is definitely the worst.
Okay,
that's
not gonna happen.
Just kidding. No, it'll never. That's not how it works.
But I think never being afraid to follow your gut and to advocate for a profession. Sometimes we're maybe intimidated in those situations. I'm not saying it's an easy thing, especially at the beginning. I don't want to say that, but if this is what you want to do, you have to walk into those conversations and take risks, you know, as long as you're believing in what you're saying.
I think there's a odd secret about that too. Like, say you go to a health system, a new grad goes to a health system, wants to work with pediatric oncology patients. I don't know that it's really obvious to some of them, but you will find out that there are oncologists and there's other advocates that you may find that are actually wanting to solve those problems for those patients.
Very much so.
They know it's there, and sometimes it's just messing with them in the back of their brain, so they want a solution. And so sometimes you walk in and you're the solution. And just saying, if you're there to have the conversation,
that's true.
You become part of the solution, and that's a good thing.
Right. And I think the other thing is face-to-face conversations. I love email. And I, you know, and then there's like messages, you know, through your EMR and things, and that's all good. But again, you're going to make impact when they know your face, they know what you look like. I'm the physical therapist that you know wants to help these kids, you know, and you can give them an example or an experience, then they're going to remember you.
Oh, the other one I forgot. The other one is read all of Lynn Tanner's research.
Oh, well, not all. Read research in general.
But read it, anything about pediatric. If you see childhood cancer, that's a good search criteria. Read all of the musculoskeletal, all the physical functioning stuff you can find. Because that puts the knowledge in their head, right? I mean, that's what we want.
and then when you're going, you know, then you have all that knowledge and in your brain when you're having some of these conversations, right? So you're coming from an evidence-based perspective when you're having these conversations.
And physician level providers, they love evidence-based.
But don't we all?
Yeah, I mean, I would rather have a footing.
Don't we all?
To stand on.
I know.
Thanks for sitting on the floor at CSM talking to me. You know, another piece of advice, come to CSM.
Come to CSM.
We're not that scary.
No.
I mean,
no, we're
not really. Honestly, like
not at all.
We're the disruptive ones in this sessions.
I know that we're sitting in the middle of the convention center right now on the floor.
So, come and find us and talk to us, and especially talk to somebody with experience, and talk to the mighty Lynn Tanner. This is the whole reason
he's really good too.
We want to connect with people because the more connections we make, the more we learn from each other, and
exactly.
CSM is living proof of that every year.
Know.
So, can you tell me a little bit about your story? What events led you to having the opportunities that you have to work with kids with cancer?
I was working in an outpatient clinic at a pediatric hospital, seeing all different, types of diagnoses and different kids. And I had a mom come in with a 4-year-old, and he was toe walking. And the mom was an incredible advocate, to be honest, and she had a lot of questions.
Okay.
At that time, I hadn't seen any child with cancer before, and she, was like, "Does this happen to other kids? Could we have done something about this? Does the chemotherapy cause this?" This was back in 2002.
Okay.
I did not have any of those answers. I continued to see the child for PT, and I went to the research.
Nice.
And there were a couple of research studies at the time talking about ankle tightness in kids, and talking about motor problems and muscle weakness. And so I was able to go back to her and say, I think this happens to other kids, and I think it is probably because of the treatment, and I think we can do a lot about it. This mom was an amazing advocate and connector, and she's like, will you talk to our oncology team about this? And so she connected me actually to her nurse practitioner.
Oh, wow.
Who then connected me to a nursing researcher.
Yeah.
Through that all, that's how we started the Stoplight program for children with cancer.
Can you tell me that initial session you had with that kid?
Yeah.
What did you say? Because you're like, you didn't know. Well, I don't know if it's caused by it.
I mean, that was a long time ago, so I don't know for sure.
You didn't just stare.
I didn't just stare. No, I said, I think I'm going to have to look into that because I don't know.
Okay.
I told her, I do think we can, no matter if it's, from his chemotherapy or not, I think that we can do something about that. We've learned a lot about the difficulties our kids with cancer have, and we have also learned about what they can do. Way back then, I just said, I don't know, and I need to look into it. Families had so many questions, and there weren't answers.
Yeah.
And so if you don't have the answers, you got to find them out.
Find it. Yeah, you got to go search for it.
Yeah.
Speaking of getting answers and stuff, sometimes the easiest place to get it is from a mentor. Did you have any mentors in oncology whenever you were getting into pediatric oncology?
I had a few. I had, I met the nursing researcher I met at the time.
Oh, yeah. Okay.
She was wonderful and taught me, that if we're going to do something new, we have to study it.
Yeah.
I wouldn't have gotten there.
I thought we just made stuff up.
I know, right? And so she was an amazing mentor. There was a PT at the time on one of the studies, Dr. Tori Marchese, that I called,
nice.
Just dialed the number
cold
called, and she was so positive and so encouraging, and like, yes, we need to learn more, and yes, we need to see these kids. And so she was really helpful. And then as I went along, I now work with Dr. Laura Gilchrist, who is an amazing scientist. And to be honest, I think my biggest mentors are the kids and parents.
You do a lot of research at this point, and obviously, hey, if you're out there and you haven't read a study that Lynn Tanner has published, you need to pause this video, open up a new tab in the browser, and search for Lynn Tanner on Google Scholar. Okay. And you'll find some good stuff out there. The cool thing is she's developed a lot of things, and it's because of this research role that she has at her facility. What can you tell me about where research started for you? Was that at the beginning? Or?
It really was. It was at the beginning that because of this nursing researcher, that she's like, I really think we have to, if we're going to start a program, our idea, right, was to start a program where all kids with leukemia would get physical therapy. And so she said, if we're going to do that, we need to look at the data and see what happens and what are we, and so it started pretty right away, and it took years and years to get it done. Now I think we have 6 research studies maybe going currently right now.
Do they all get written up? They all going to?
Yes, of course. Yeah. Oh gosh,
you can't do research without writing it up, right?
No, and even if we don't get what we, I mean, I think that's the important thing too. Is
no significant change is still good.
No significant change is still good research. Yeah. If this didn't work, we need to tell everybody
people
this
doesn't work.
This didn't work. These
don't
are
repeat
ideas.
this. Yeah, change your methodology.
No, I know.
What sort of things about your job, about the day in and day out of working with these kids or working on the research around them, what fuels your passion for this? Because you are somebody you got a lot of energy. It's fun to sit next to her because it's kind of like sitting near caffeine or something. You breathe it in and you're just like, oh yeah, that's awesome.
I can talk real fast. The kids do.
Okay.
I mean, every child, whether you get to meet them once or twice or whether, what's so cool is now I have kids that I saw when they were 3 and now they're going to college. They teach you something, they share something with you, they bring you joy. Even in sometimes when there doesn't maybe seem to be, when things seem pretty tough, they'll crack a joke. Or
say something really profound.
Something that's,
like,
and wise, As an adult, our perspective can be kind of jaded, I mean, we got a lot of thoughts going in there, and kids, I always think I have 3 kids, right? So I always want to give that child what I would want for my child. But connection. I think my highest value is connection. I don't want cancer to take away their dreams if it doesn't have to.
Absolutely.
Right? Like
you're there to restore, not
if they wanted to play hockey, I want them to play hockey. If they wanted to go, I had this family say, if my child wants to, can they go to the Olympics? And I'm like, yes, I think so. I don't know but we're gonna try.
Yeah. You're just like, well, where's your dream? What's the goal? What's that end goal for you?
What's important to you? What's important to you?
I feel like that's the answer to long-term exercise protocols.
Yeah.
We reconnect them with that dream.
I've had some teens that like to hunt. Okay, how are we going to get back out hunting? Learned about like spearfishing. Yeah. I've learned all sorts of things.
Oh man.
Working with these kids, right?
Yeah, absolutely.
I'm sorry. I can get.
Yeah, I was just thinking about you throwing a javelin down a hallway to hospital.
But I was telling him, we were working on balance.
Yeah.
Right? And I was like, this is good for your balance. Yeah. I mean, you're standing up on a boat, and he was safe enough to do this at this time.
I love it, and the best thing about PT for this age group is it's mimicking the real world inside the treatment facility or wherever. So like sometimes you're building an elaborate hoax to simulate a certain thing, like spearfishing.
It's such a collaborative field between the oncologists and the nurses and the nurse practitioners and the social work and the families and the front desk, and we've done a PT session could be a dance performance for the nurses back in the infusion center, and we've had physicians skipping around the clinic because we were working with a kid working on skipping. Making it that physical activity is important for all of us,
and everyone's setting this really great good example that kids are worth stepping away from your busy day to just be a kid for 5 minutes with them. Do you feel like your patients make you laugh?
Daily.
What kind of things?
Daily. Lately it's been a lot of TikTok dances.
Oh yeah. I have the music inside me and it doesn't know how to come out.
Like Renegade, I can't, I know. I mean, but they're teaching me and they put up with me.
Would you say that on a day in, day out basis that there are fun things about what you do?
Every day.
Yeah.
It spans the range of emotions.
Yeah. Like
the best joy out there, and then there's maybe the saddest sad.
Yes.
All in a day, but there's that connection of human beings, right? Yeah, every
day
you
open
is
yourself
a different
up
day.
For a wound there a little bit, too.
You do.
But
you do.
It's worth the...
Oh, it's worth it,
right?
Even kids that I've had that have passed away, I was lucky enough to meet them.
Yes. Yep.
And maybe their life was short, but they brought something to this world, and I was lucky enough to meet them.
There's something,
and I hold that. I hold a part of them.
It's incredible meaning in a short period of time.
Oh, crazy!
Yeah, amazing. Well, thank you so much for talking to me. Thanks for sitting on the floor.
I know.
Alrighty.
Yeah.
Thank you so much.
Thank you,
guys. Okay.
That was kind of fun.